Thank you. Dr. James Davis.
Thank you, Chair, and thank you, Secretary of State. Firstly, a question about rapid testing. Can you tell us what percentage of frontline NHS staff now have access to twice-weekly lateral flow tests, please?
In England, it is, I'm told it's 100%.
Fantastic.
Now,
okay.
If somebody hasn't been given them, then let me know. But we've supplied 100% to the frontline in hospitals.
Okay, because they're yet to roll out in North Wales at all, but that's very interesting. Thank you. And in terms of vaccination, can you tell me when you anticipate knowing whether those who've been vaccinated are still able to transmit COVID?
That is an incredibly important question that I don't know the answer to, I want to know. So obviously we have a pharmacovigilance program to follow people who've been vaccinated. It is the hardest question to find out whether they still transmit for obvious reasons. But we are studying that, and I will write to you as soon as I know when we'll know. In fact, I might ask the CMO to write to you, doctor to doctor, with his best estimate of when we'll be able to assess that. We won't be able to put a date on it yet, I'm sure, but it's about how we will get to that assessment.
That would be much appreciated. Next question, capacity of vaccine production to meet our targets. Do you have concerns over the availability of the vaccines?
Well, obviously, we'd all want more vaccine to be available, but I want to be really clear about what the challenge is here and where the rate limiting step is, because we have, as we were discussing earlier in the session, we have hundreds of places across the UK that are vaccinating, and that is not the capacity constraint. The capacity constraint is the supply of the approved vaccine. That doesn't mean there's been a delay, and it is not a criticism at all of the manufacturers. They're working as fast as they can. It's that making this stuff is hard. I said in the chamber yesterday, it's a bit like if you're into your baking, it's a bit like you're growing your yeast. It's a biological process. And so that that is the delivery schedule, and we're delivering the kit that we've got, and that's where the constraint is.
Understood. And finally, there's huge interest, of course, in the priority groups, the JCVI priority groups for receipt of the vaccine. Now, I know there are 9 groups within phase 1. We're working through, and hopefully we'll reach level 4 by mid-February. But you'll be aware of calls from teachers, from those who work in nurseries, from those who work in funeral directors, the police and so forth. So essentially people who have contact with people on a regular basis to be given some kind of priority. Now, I know currently they feature under phase 2. What is the political process for agreeing the priorities there? And do you think there's any prospect that some of those individuals might move up alongside groups in phase 1?
The JCVI prioritization is really clear, and we are committed to vaccinating according to that clinical priority. The order after that clinical priority, essentially for the under 50s who don't have conditions that make them particularly vulnerable to COVID, that is not yet decided, and I'm sure that it will be debated, and then we'll come to a decision. I think that teachers and nursery workers have a good case to make, as do the police and other public servants. There's key workers across the board. So that is a debate that we will need to have and come to a decision on.
Thank you.
Thank you.